It's all about acceptance and ending prejudice and discrimination when it comes to mental health, especially for our keiki. In fact, this week is Children's Mental Health Acceptance Week. And joining us this morning with more is Dr. Mestiza Gass, Program Director for Mental Health America of Hawaii. Good morning, Dr. Gass. How are you doing this morning?
Doing excellent. Thank you.
Now, first off, what can you tell us about this year's theme?
This year's theme is really important, I think, because we've seen so many changes in the last 2.5 years. So we're really focusing on the acceptance portion, so saying it's okay to not be okay. We're looking at advocacy, so how can we get more involved, make sure there's a lot of nets of support for our youth, and then act. What can we do to make our community more resilient and to help our youth transition into a successful adulthood?
And what does this theme, accept, advocate, and act, mean to you?
I think it's one that's really close to my heart because we have to be aware of the fact that there have been these big changes that have happened, including increased depression, anxiety, difficulty transitioning into adulthood. And so we have to start to be creative and make those changes now and to be able to make them more resilient and have a lot more support in the community. And so that part of that conversation is de-siloing mental health and making sure that as many of us as possible are prepared to be able to support them.
Has the pandemic had a big impact in terms of mental health, especially for our keiki?
We're still waiting to see what the actual result has been, but the preliminary pieces have really shown us that there's more anxiety, more depression. There's even things like interrupted grief and a difficult time kind of transitioning into adulthood because of all the things that have happened.
And what kind of events are being planned for this entire month, actually?
It's actually what we like to think of as all year round, but specifically this month we really highlight the importance of educating yourself about children's mental health, going to the Child and Adolescent Mental Health Division website to see all the wonderful things they're doing, maybe going to visit one of the buildings that have been lighted up for this event or using some of the hashtags. But we also have a lot of other things that happen throughout the year. We make sure that we have different events such as Hike for Hope, which is family friendly. We just had our Mahalo Awards, which really highlighted the work that's being done, including with the police department. So they do the crisis intervention training. They have an additional 40 hours of training just to support our youth and the families if there's a mental health crisis. So that's something that you can actually request. There's all types of ways that people can become advocates, get involved, and participate in making sure that our youth have what they need.
And of course, we'll have all that information on our website at KH12.com. But mental health, we need to have these conversations and bring it out to the forefront so that people don't have the stigma or
Absolutely.
prejudice. All right, thank you very much, Dr. Gass. Appreciate your time.
Thank you.